Health Today, a podcast by Triad Behavioral Health, where we cover trending topics in behavioral and mental health. This podcast is designed to share unique and relevant topics occurring within the world, our communities, and bring them a mental health perspective.
Welcome, I'm your host, Dr. Graham Taylor, and with me today is Dr. Lawrie Ignacio. Dr. Ignacio is a licensed clinical psychologist in full-time private practice in Honolulu, Hawaii. She's also an adjunct professor of clinical psychology at the Hawaii School of Professional Psychology. Dr. Ignacio has expertise in adult, individual, and couple psychotherapy, clinical psychology, personality assessment, and in trauma. Lawrie, nice to have you with us today. Welcome to Behavioral Health Today.
Thank you. I'm glad to be here.
We're addressing a really unique and unprecedented event in our nation and our world's history. We're talking about the coronavirus, also known as the COVID-19. And we've seen the multiple impacts of this pandemic in the way that our daily lives have been changed from the things that we typically know that are normal for us, our freedoms, the way our economy is going, our business dealings, things including our health and our well-being, our safety. All of these things have been just dramatically and profoundly impacted. What you and I had a chance to do in our prior two podcasts was to create some in-depth understanding and to begin to articulate clearly what's underneath the various emotional and psychological reactions that we're seeing being experienced in our society around this pandemic. We had a chance to kind of name and ideally normalize and explain some of the physical, the emotional, and some of the cognitive processes that we know are going on. We had four that we talked about last time.
That's right. We had biological reactions to what's happening during this time that include, our fight or flight response, for example. Yeah. We talked about our stages of loss that we are all going through in some way, shape, or form with respect to the losses that are coming with this pandemic. It's prime time for some of our core existential fears to surface. And there's a specific form of grief that is characterizing a lot of our reactions to the virus right now.
Yeah, the pandemic is touching all four of those areas biologically, the losses we're going through, the existential fears, and grief. And what we tried to do is to create some meaning for what's going on. And if we can create some meaning, we can get some understanding. Understanding allows us to kind of move into a place of control and then decision making, going from kind of a reactive state to an action state. Yes. And what we want to do, we want to take the podcasts that we did in the last two times, and we want to today talk about and focus on the ways that we can successfully and resiliently navigate the kind of normal, inherent, expected challenges in each of these four areas that you just mentioned and named. And if we can talk about these four areas, we can begin to see how we can not just go through them, but maybe we can develop some resilience. When we talk about resilience, we're talking about something that's pretty unique.
Right. Resilience being our capacity to respond to something like what's happening with the COVID-19 virus, and not only acknowledge the parts that maybe are not quite changeable, but we can move into places like acceptance. We can develop meaning in the context of this, all of which gives us a sense of agency and even transcendence, which we'll talk about in a little bit.
I like that. I was reading a sports psychologist the other day, Michael Gervais. He's a very well-known sports psychologist. And he was talking about how resilience is like bounce, but it's not just bounce, it's bouncing forward. This idea that when we hit hard times, it's about learning how to adapt, even thrive. And what you mentioned earlier that we're going to talk about in our podcast today are ways that we can be intentional about this pandemic time, such that we can thrive, we can grow.
Yes, intentionality is a huge part of resilience, right? It's not just being in reaction, but allowing the self to look at what's happening and how do I move forward with intention and resilience, adaptability, agency, meaning. All of those things are part of resilience.
And the cool part about that is that's something that we can go into, that's part of our control. We talked about four main areas. You've gone over the very first time. We talked about the biological reactions that we're all having here right now. Let's just kind of name what that's about. So that's about, we're hardwired.
Yes.
We like predictability. Our brains like to know what's going to be going on. And what happens is that we're in this pandemic state with the way it's being covered in the media, the uncertainty about it. We're walking around in some fight or flight reactions, aren't we?
Yes.
Kind of a state of vigilance almost.
Absolutely. Yes. This is the primal brain, right? To the extent that COVID brings up a lot of fear, this can stimulate in us this sense of hypervigilance and being in either a freeze or flight sort of state of mind, where you're on some level hijacked by a sense of anxiety that can either want to make you flee and move or be immobilized and stuck.
What is interesting about the fight or flight is that the brain can't necessarily by itself, nervous system can't distinguish between a real threat and a perceived threat. They did a study one time where this guy was put in front of a bus. They didn't make it too life-threatening, but they put him in front of a bus. They had him hooked up to all the biofeedback stuff. So he saw the bus coming at him. They got all the measurements, pulled him out of the way at the last minute. Then they put him in a laboratory, hooked him up, and asked him to imagine the bus coming at him. And the readings were just about the same. Not much different. So showing that the brain doesn't know. So what we imagine, what we tell ourselves, what we label happening, our brain reacts to it.
That's right.
So one of the ways that we can reduce the fight or flight is our self-talk.
Yes.
Say a little bit more about that.
Yeah, basically we can, first of all, notice that we're in a state of fear or fight or flight. And we can actually ask ourselves, how am I talking to myself about what's happening? We can function out of a fear-based way of speaking to ourselves, or we can actually harness the mindful part of ourselves and say, okay, I am scared, but what can I be saying to myself that doesn't increase the fear? So that might be the difference between a fear-based self-talk, which might sound something like, I need to be vigilant about everything because I could die and I could cause someone else to die, or I myself can die.
So the
and
brain
that's a
hears
fear.
that.
That's right. The
brain hears that, and it goes into this vigilant, hyper-aware state that's always firing. It's never resting. It's always anticipating the boogeyman jumping out.
Absolutely. Yeah. And then your whole body will follow suit. You may have sleep problems or being a state of hypervigilance and anxiety. The other option is to acknowledge that there is fear around what's happening right now, but take hold of that in a mindful, intentional way with self-talk or mantras, whatever you want to call them. I'm doing everything I can, and I'm going to do everything I can to keep myself and other people safe. But this isn't a perfect process. And reminding myself that although some people are really getting hurt and dying from this, there are things that I can do to keep myself safe.
You talk a lot about the mindfulness idea, and that is about raising awareness of what our narrative really is. Our narrative's going on all the time, whether we're conscious of it or not. Right. And this idea you're saying with the self-talk is, are we seeing this time as a threat that we can't control, or are we saying there's some threat to it, but what are the multiple steps that I can take and to begin to shift our narrative in a mindful way into identifying and then implementing those things that we can control. What we know in addition to the self-talk is there are a number of other things we can do. You do a lot of meditation. Talk about that, the benefit of that, and bringing the biological reactions and the fight or flight down.
Yes, there's a lot we can do to manage that fight or flight, anxious reactivity. Everything as simple as a guided meditation that you might access on YouTube. There are wonderful ones that are free. Guided meditations to calm the body and the mind, to reduce anxiety, to reduce panic, to improve sleep. All of those are wonderful to take advantage of. This might be the time to practice and learn something more formal, a formal meditation like Transcendental meditation, which is one of my favorites. Very helpful way to manage anxiety, and not only manage anxiety, but also experience a sense of inner peace and calm that can only come from practices such as that. Progressive muscle relaxation is a very easy one to do.
That's one of my favorites. I know you do the TM, but I can't kind of focus on that way. So I need to be doing something. So the progressive muscle relaxation, I'm tensing and then I'm letting go. Tensing and just noticing and experiencing kind of that relaxed state. So these are different ways.
Yes, and we can access these essentially for free. That's what I love. You can go on YouTube and find a really good progressive muscle relaxation guide.
You've talked about too, we've done this a little bit in our work, where some people experience a extremely intense anxiety that they can't get out of. And it just feels like it's just going to swallow them up. We're going to talk about a couple of other ways to manage and reduce the fight or flight, but one of them, if it's really extreme, it's the mammalian dive reflex. Talk about that.
So these are for folks that are hijacked by anxiety and bordering on full-blown panic. So one technique that you can actually use is what's called the mammalian dive reflex. You can look it up to see the actual steps, but essentially what you do is you take a bowl or a sink of ice cold water and stick your head in there, and not your whole head. You just have to immerse the face, hold your breath and stay in there for a little while, come back up and do it again. This can be an effective technique to activate the parasympathetic nervous system that'll calm the body down. It's very helpful in those cases where none of these other techniques will work.
Yeah, that's good. Hopefully not many people have to use that, but it's there if they need to, if they cannot get themselves out of that state.
Right.
We also know things like yoga, some breathing practices. I love breathing practice. I do that a lot in my work just for people to get centered and focused.
Yes.
I like to talk about the breathing practices where we do a 2-for-1 ratio on the inhales and exhales. So I'm going to inhale, but my exhale is going to be twice as long as my inhale.
Right. Yeah. I'm
breathing in through my nose, out through my mouth. I also like the 4-7-8, where you breathe in for 4 seconds, you hold your breath for 7 seconds, and then you exhale for 8. Basically what you're doing is you're demonstrating to yourself that you actually do have control over your physiological reactions. When you do that, your heart rate goes down, your blood pressure goes down, your blood vessels dilate, you've got this great rich oxygenated blood, you might feel a little tingly, but all of those things short circuit and turn off, activate the parasympathetic nervous system. Parasympathetic, paramedic. Paramedics help us fix things. So the paramedic sympathetic nervous system is something we can activate, bring down that fight or flight, and return some control.
Yes.
Things like sleep hygiene or exercise.
Yes. But yeah, sleep hygiene, which is essentially a ritual for sleep that involves a soothing ritual to go to sleep without stimulation.
Good. We also want to take some time out. You know, we say this all the time, but sometimes you need to turn off the media. We know that the media tends to exacerbate or exaggerate some of the panic. And so sometimes we just need to have some timeout zones where there's just no exposure. We have some patients we work with, a couple we work with. He only watches in the morning and at night. You get the beginning and the end of the day, not necessarily before bedtime, but before dinner, something to talk about. But other than that, the rest of their day is kind of panic-free. Let's shift a little bit. So we're going to move into this idea of stages of loss. And the stages of loss, it goes into Kubler-Ross's death and dying stages: denial, bargaining, anger, depression, acceptance. And we're talking about transcendence in just a moment. And what we want to understand is that each one of us has gone through each of those steps. And we might go not necessarily in a linear fashion, like you said last time. And we go through these steps multiple times. We can circle back around to something. If something's extended, I might get angry. Or if the quarantine is prolonged, I might get depressed. Or if my finances are kicking in, I might get depressed. Whatever it may be. The idea is to work to acceptance, because that's kind of where the power is, in the acceptance of those things. But before that, we can go back and forth. So the idea is to kind of find out what stage that we're in.
We would suggest that you be mindful about how you are feeling and what stage you might be in at any particular time. So first of all is the awareness of it. And then identifying what's at the heart of what I'm feeling and thinking in this state. And with that attention and then the intention to harness where you are, and then finding some strategies to navigate that particular stage.
So you mentioned before that oftentimes anger is just a lack of control or a fear of loss.
That's right.
These are things that maybe we don't understand. We just kind of get angry, but we don't understand. So you're saying mind down inside.
Yes, try and see what's underneath what you're feeling in terms of these stages of loss. If I'm in denial, what am I trying to deny? What am I trying to keep hidden? And allow that to be within your awareness. And then there you can feel like you have some agency about how I'm going to respond. If not, we're just going to react to those feelings.
So what you're saying is if you're feeling angry, you're trying to bargain or haggle, some ways to manage this, you're maybe depressed. You're not saying necessarily jump out of those stages.
No.
In fact, you're saying maybe stay in those stages
for a bit.
And maybe find someone to talk with or kind of mind down with you.
That's right.
With the hope of what?
With the hope of understanding it and then bringing to bear some choice and agency, some real intention about what might I do to not only acknowledge the state that I'm in, which is a form of acceptance, but what might I do within this particular stage to feel better about it. Both of acceptance of it and also some strategies to offset some of the intense feelings around it.
You said earlier, it's not a linear process, and we might circle back to some of these stages again. Ideally, when we circle back, we recognize it, we don't stay there as long, and we work through it faster. And we move back down to the acceptance where we're saying there are some things I can't control, but there are also some things that I can. But then we get to move to a place of meaning and transcendence. Talk a little bit about that. So this idea of transcendence.
So I think that's the ultimate goal, is to not only acknowledge and understand what stage I'm in, but it's what we're trying to move toward is transcending the current situation in very intentional, meaningful ways. So with this, we might want to ask ourselves, for example, how do I turn this time into something meaningful? How do I turn this time into altruism, for example, or a source of fulfillment? How do I turn this time into a source of spiritual awakening?
Right.
Or how do I maybe rise above to a new way of being, a new way of identifying myself, a new way of seeing something, a new way of learning, a new way of contributing? These are all questions we can sit with, and not just sit with, journal about, talk to people, like-minded people about, talk to a therapist about, really integrate these and make it an intentional act and a way of being that I'm going to not only accept what I can't change and prepare myself in ways to keep me safe, of course, but also how do I rise above it in very meaningful, intentional ways.
I like that. I love the idea that we get to use this time to create meaningful things out of it, that
That's
ideally
right.
when we transition back,
Right.
these are takeaways from this time
Yes.
that reflect our growth, improvement,
Yes.
expansion, whatever it may be. We can even do some small things as well.
Yeah.
While we're doing that internal work, we can do things like give blood.
Yes.
We can check on our neighbors, particularly the elderly. I'm working with one patient right now who's a little bit elderly, and she's got this 14-year-old boy who lives next door, does all her shopping for her.
Yes.
And it's awesome. He comes by and rakes her leaves and picks up her mail, puts it under the door,
Yes.
and does all these things that are just kind of the transcendent part of this.
Yes.
That are good. We got one person we talked to is making masks.
Yep.
Volunteering virtually.
That's right.
Making masks, sending them out,
That's
sending
right.
a card, calling people. Someone gives a little bit extra tip. You know, some of the
Yeah.
workers right now with takeout, they're struggling. They leave a bit extra tip or gift certificates, buying things now for future meals, but keeping the local businesses,
Absolutely.
going. So
Absolutely.
pretty cool things.
Yeah. I have clients that are in the restaurant business who have harnessed a bunch of friends and colleagues to create a program that feeds people who are struggling right now. So those kinds of acts of kindness and transcendence can be very meaningful and also can make us feel good during a time with kind of scary stuff going on.
I think it's those acts that we're going to remember most.
Yeah.
Let's shift a little bit. So we've got an understanding of the biological reactions and some of the things that we have control over and we can do. We're recognizing the stages of loss that each one of us go through, but there's each of these stages, there's a task that we might get to through some understanding and mindfulness, work through, talk through, feel through, that allow us to move to more transcendent, meaningful places where we can accept what we're in, but really grow in some ways, kind of bouncing forward, as we said before. Let's shift a little bit and talk about existential fears. This is something that we all have.
Right.
More times than not, they're either unconscious or we're kind of outrunning them. We're staying busy.
Right.
But ideally, with these existential fears, we're going to name them in just a moment. Ideally, we can acknowledge them
Yes.
as fears or maybe just concerns or things of uncertainty within ourselves. We all have them. But they're only a fear if we're not addressing them.
Yes. Exactly.
Or if we're trying to outrun them or just ignore them.
That's right.
So when we have this time now, ideally, as they're surfacing, and COVID is touching each one of these four,
Yes,
each one uniquely,
Yeah.
we get an opportunity to say, hey, how might I grow and how might I work through each one of these fears or / challenges?
Yes. Yes. So this time, thinking about one author who calls it an awakening experience, that all of us sort of have these unconscious fears and existential givens of existence that we all walk around with in terms of our fear of death, our fear of a loss of meaning, a fear of isolation. All of these things, COVID is just percolating all of these, and all of these are bursting into conscious awareness now, and let alone not having our usual ways of living and coping and being out in the world that would keep these at bay.
So those structures, those constraints that are usually there that keep those things at bay, they're no longer there.
No, and so these fears come busting through the proverbial surface of the unconscious, right? And so here they are. Part of the whole process of coming to terms with these, same author would say, there's something about staring at the sun a little bit and not going underground with them, right? Hard to stare at the sun, but a little bit. Put some sunglasses on, right? And look at these. So these are also opportunities to grow through these kinds of existential angst experiences.
So as these are surfacing, because there's no structure, barriers, those things that keep them out of our awareness, let's go down through each one. So the first one is this fear of control.
Loss of control.
Loss of control. Yeah.
Yeah. It's this realization that as much as we have agency in the world, we ultimately have control over relatively little in the larger scheme of things. We can't control the COVID experience in its totality, but we can also have agency in ways that make it tolerable, if not livable. What are the things that I accept as out of my control and relinquishing that, because we can make ourselves crazy trying to control stuff that we actually can't, like how long we're going to be in quarantine or how many people I'm going to meet at the grocery store without a mask. I mean, those kinds of things.
So it's not denying, it's in
no.
fact holding the parts that are out of control.
That's right. And then moving into places where I can exert some healthy agency, you know, and accept the things I can't change and change the things that I can. Right.
Yeah, I like that. That might even be things like how are you budgeting and staying healthy? Things like the hygiene, the personal spacing, the wearing of masks, working from home.
Right.
All of these things are under our control.
Yeah.
And they don't reduce all the risk, but they take away a great deal of it. And those things that we can control, let's identify them and seize them.
Yes,
and just control the heck out of them.
Yeah, and seize them. What is this time allowing us to do, or ways of thinking about something that may be unique to this time?
Yeah,
you know?
Agreed. Isolation is another one of our existential fears. This is fear of being truly alone. And on top of that, not am I fearing that I'm truly alone, but does anybody truly really know actually who I am?
Yes.
And what I'm truly experiencing?
Yeah.
And the thing here is that fear can sometimes shut us down a wee bit. And our task here is to make sure that we are establishing open and honest relationships where we are giving people a chance to know us, where we're reaching out.
Absolutely.
We're watching a lot of people use some social media, whether it's FaceTime or Zoom, to kind of reach out and talk. Other ways, people are taking walks together, maintaining some good personal spacing, sharing with each other aspects of their struggle, and being a support to other people. That's a way to reduce isolation. Be a listener sometimes, not always a talker.
Absolutely.
And talk about things that are non-COVID related. I mean, there's so much else going on in life right now, and we don't want to let COVID kind of eclipse all the other things that are of importance as well. Yeah,
this existential fear is probably one of the largest ones right now with the quarantine, right? We know at a very deep unconscious level that we come into the world alone and we're going to leave alone. So we carry around this dread of being essentially isolated from each other. So with the quarantine, it's just really heightening this. So one of the tasks here is trying to find ways of meaningful connection. You know, we're isolated beings, but needing connection. So finding creative ways to stay connected to other people will offset that fear of essentially being alone and dying alone. Yeah.
Our identity, that's one of our existential fears. And funny enough, it is coming up in this time because the mandated quarantine for a good number of people is taking them out of the roles and the structures, like you said earlier, that they're normally familiar with.
And hold us together.
Yeah. Both in the biological way, but also in who we are in our identity.
That's right. A lot of us define ourselves by our roles, right? I'm fill in the blank. I'm a psychologist that goes to my office and I see people all day, or I'm an author who, shares my stories with other people. What's happening with COVID and isolation together kind of threatens who am I? It's an opportunity, again, to define the self during this time. We can ask ourselves questions. Who do I want to be during this time? How do I want to define myself during this time? And even moving forward, going through this experience is also an opportunity to either redefine the self.
So you're saying in that case, am I dependent upon an external label, almost like an external locus of control? I'm okay as long as I have this label or this role or this structure. Or in the absence of that, do I have an internal clarity and definition? Meaning also comes under this identity a little bit too. This idea, it's kind of a crisis of meaning, kind of weaves in here.
Yeah, I mean, meaning, it's a lot of it is defined by the structures and the roles and the people around us. We don't have a good reason for why this is happening now. So we can be confronted with a crisis of meaning. We can't go to the top of a mountaintop and ask some guru, why is COVID hitting us and why is this all happening? We don't have answers that bring a certainty and a sense of why is this happening?
But you talk a lot about this idea that if we can stop and acknowledge that it might be an opportunity to create some meaning.
That's right.
And if we can be mindful in doing so, something gets to happen that doesn't happen to us by default, or someone else assigning it to us, we can develop it from within. Again, it's opportunity that we can seize and we can do something with. The last existential fear is the fear of death. Death anxiety.
Yeah, it's probably the biggest one.
Probably the biggest one. And sometimes it's, talking about looking at the sun, a lot of people don't want to address this one, or they kind of kick the can down the road and say, I'll get to that when I have to. But our encouragement is not to avoid this one. Not to avoid the hard questions around it. Really tolerate trying to stare at the sun. I love that analogy around this one. And my hope in this time, because we are faced with death, the COVID virus is killing people. Most people have some pre-existing conditions that increase the risk, but nonetheless, this is a virus that is killing people, like some other viruses do. But if we can address this now, this fear of death, and we can develop a knowing about what we believe, we get to live our lives out freely with this understanding.
That's right. That's right. I would add that there's nothing that harnesses the life force than knowing that there's the death force. And so we can either succumb to the fear that, this thing is killing people and could kill me. That's the ultimate fear, or kill people that I love. There's nothing that can harness the life force, which with a sense of positive urgency to live. It's sort of like the song, live like you're dying. And the whole premise there is that we harness that fear with intention and to live fully and purposefully. That's right.
With a sense of knowing that's not a fear,
right?
But it's empowering. Back in the day, the Sharper Image put out this clock that you could put on your desk. And it took your current age, and it took the average age where people pass, and it started a clock counting down backwards, telling you how much time you had left to live.
I don't know if I could do that, but yes. That's hardcore staring at the sun.
Seriously, I'm like, every morning, I've got this many hours, this many minutes, this many days left. And, but it creates some intention and some purposefulness.
Positive urgency.
Positive
to
urgency.
Live.
So ideally with these existential fears, they're surfacing now. So let's lean into them. And let's recognize them for what they are, not be scared of them. They're only fears if we don't look at them.
That's right.
And if we can grow and we can work through each one of these challenges, we get to kind of free ourselves up and come into the post-pandemic time, ideally much more full. The last area we're going to talk about that we had in our prior podcast had to do with the grief that is unique to this time. It's not just regular grief, it's a unique grief in that collectively, as a neighborhood, as a community, as a nation, as a world, literally, we're all going through a grief right now that taps into a lack of certainty, a lack of predictability, and a lack of safety. And it touches in the loss really in two main areas. The first one's in the loss of normalcy and the things that we normally do.
The loss of normalcy. And as you talk a lot about, Graham, is this anticipatory grief. We are uniquely positioned in the universe to be able to not only be fearful in the present, but also be fearful based on what we think is going to happen, what we can anticipate. So there's the losses that you can anticipate, or the fears you can continue to anticipate. And they're, like you were saying earlier, the brain, and the brain doesn't know the difference between current fears based in the here and now and fears, and losses that we can predict, weeks to months to years out.
So this idea, this anticipatory grief, it's really the hardest type of the grief. But there are some things that we can do about this too. We kind of go back to the automatic thoughts. Because what we're telling ourselves is what we're going to be living. I think it was Henry Ford that says, whether you think you can or you think you can't, either way you're going to be right. The idea being that our thoughts and our beliefs are going to set the template, the premise for how we see things, experience things, and what we're going to be expecting. I like the idea too. I cringe sometimes when we use this word social distancing, and I see it as really being a misnomer. It's really about physical distancing, while we're still trying to stay socially connected.
That's right.
When you look at birds, on a wire, they're all perfectly positioned apart. Their proximity is almost exact. And so this idea that we're looking to socially distance right now suggests that I need to fear you. That somehow you're a threat to me. So socially, I need to distance from you. But I thought, what if we were to change that word from social distancing to personal spacing, like the birds do? It's just a little bit more. So we know that most Americans like about 2.5 to 3 feet distance. And they're suggesting, well, let's have 6 feet difference. All we're doing is adding 3 feet to this social distancing. What they're saying is, what if we just continue to expand our personal space?
Absolutely.
Take out the social distance.
Yeah.
We get to have some self-care with 6 feet.
Yeah.
But without the interpersonal reference that somehow you're a threat to me and I need to distance myself from you socially. I don't think that's right.
I totally agree.
At 3 feet, we're going to be fine.
Yes, exactly. What are we distancing for? It's really coming not from a place of fear. It's coming from a place of self-care and self-love and the love and the care that I have for you, right? If we really harness that kind of more actual or more realistic thinking around this, we get to right-size a lot of the fear that comes from social distancing, as if you're the predator, as if you can hurt me, as if you can harm me. No, we're doing it so that we can not only stay connected socially, but that I care for myself. And in doing that, I extend love and care for you. That's what's happening, really, when we're doing this.
When you're talking about that too, I think about in the work that we do some trainings for folks. We do weekend retreats for couples, and we talk about the importance of attachment.
Yes.
And when we socially disconnect, we actually create a very great and very deep fear within each one of us. So we were talking the other day about how when we're wearing masks, it's replicating the still face experience. For those that are listening, if you want to go on YouTube and type in still face experiment on YouTube, it's about a 2.5, 3 minute video, but it talks about how in the absence of proper mirroring a mother to a child, facial features that demonstrate engagement and understanding and joining. And in the absence of that, how the child really struggles. And we're walking around now with masks on, glasses on. We can't even see each other's face sometimes. And so we're replicating this still-faced experiment and talk about upping our anxiety and, the sense of threat.
Absolutely. Absolutely. Although, so it's going to be really important to define and redefine for ourselves what putting the mask on means, because putting it on will actually stimulate some of these fears already.
That's right.
Right? That I can only see your eyes and there's no real engagement, and it can bring up those very primal fears. We reframe it, and what does it mean? Then we can counteract some of those fears for sure.
I like it. So challenging some of the negative thoughts. Staying focused on ourselves, not worrying about what other people are doing. These are all ways to kind of reduce some of our anticipatory grief. We also know that with the loss of normalcy right now, things like celebrations, like proms and graduations, I feel sorry for some of the seniors, people reaching pinnacle parts of their lives, or weddings, or even funerals. We talked in a group we're running for first responders. We have this woman in our group who has a mom in another country. And she's dying. And there's no way she could possibly see her. And her mom's likely going to be dying alone. So this normalcy of how we process grief or loss, or how we join each other in it. These are things, though, that we can begin to maybe restore some sense of normalcy. Things like maybe Zooming in or FaceTiming each other with a dinner. I've got somebody who calls up a group of moms every day, and they describe themselves as their employers, and the employees are their children. And they'll talk about what their employee did that day, like they barfed, or they did this, or they, dropped their diaper, or something occurred, or they hit their sister, or whatever it may be. So just something fun and playful. But they're doing it as best they can to stay connected, but they're doing it through some social media, Zoom, FaceTime, whatever else it may be.
Excellent. And I have a mom who has a daughter who schedules with other moms virtual play dates for their daughters. So one daughter is baking while her little friend is baking in her kitchen. So it's moms and daughters baking together virtually. Those kinds of things I love.
I know some people are doing story times too, just kind of reading to each other. I know this one grandmother, I think I might have mentioned before,
about her,
both parents are not working right now. So the stress level is pretty high in the home, and they live on the mainland. And the grandmother here in Hawaii will call 2 granddaughters, so the parents get to go walk around the block. I have a little date night, and they'll read Harry Potter or whatever story it may be. It's a time for the grandmother and the granddaughters, but also for the time for parents to kind of just get some normalcy, some couples time back into their life.
Isn't that great?
It's pretty cool.
And would that even happen outside of this time? So this is the opportunity, right? So great.
I like that. So there's a lot of things we can do to restore the normalcy. Even things with pets, making lists of the things that we can control. Sometimes we get so afraid, our vision becomes kind of myopic and small. And if we can begin even to journal some things, here are the things that I can control. And there's usually a tremendous list of things we can control. Again, seize those, like you said earlier. Or the things that we can't, let's do some workarounds, or just accept them radically. Because we may not be able to control them, but we can stay safe regardless.
And what's normal is what's happening now. So right now we have a new normal, and we get to actually create the new normal for now. We get to anticipate what normalcy might look like later. Yeah. Normalcy is just what everybody does. Yeah. It doesn't necessarily completely define us. So that's the opportunity. Right?
Exactly. Agreed. Well, we're coming to a place where we're kind of winding down, and we had a chance to go back over the 4 areas that we talked about in our 2 prior podcasts. The idea of our biological reactions, the stages of loss that we're all going through, the existential fears that this pandemic is touching, and the unique grief that we're all going through. And ideally, we're not just going to stay stuck in those 4 theories or concepts that we're presenting, but there are ways that we can kind of rise above these that can create some real meaning and purposefulness. Well, as we close today, we know that we're going to be in the quarantine for a little while longer, but there are some things that we know that we can't control, but we do know that there are many things that we can. That we can actually not just control this time in some meaningful ways, but there are meaningful ways that we can actually grow.
Mm-hmm. So, Graham, you and I would encourage people to think about what makes us feel better, what helps us improve our mental and physical health, how we can achieve these with limited resources right now, think creatively in these ways. Think about social supports, how to access friends and family online, to reach out to people, developing new communities, new ways of connecting. And finally, remember that the vast majority of people, including all of us who are experiencing difficulties during this time and along the way for a little bit longer, will ultimately do well. This will pass. This is transitory and it won't last forever.
Yeah, I like that. So we really do have an opportunity to develop and grow our resilience, this idea of bouncing and getting back up, but bouncing forward. And it's a choice that we all have to make. And our hope is, and our encouragement is that people take us up on this choice, develop some resilience during this time, find ways to grow. And while we're not minimizing in this talk, and we do in no way mean to minimize the heartache that some are truly experiencing through financial losses, separations, even death, there are ways that we can find and share some really creative solutions to the problems that we're facing, and taking care of ourselves, our families, in the best way that we possibly can, and trying to stay connected as best we can during this time. Personally spaced, don't distance, stay socially connected in the best ways you can. And in doing so, we'll be reminding ourselves that we are in this together and that we're going to get through this together as well. Well, Lawrie, thanks for joining me today. It's been great to be with you.
You're welcome. Glad to be here.
And for those listening, thanks so much for joining us. And we look forward to having you join us in our next podcast with Behavioral Health Today.
Behavioral Health Today is a podcast part of the Triad Behavioral Health Network, all rights reserved.